Good afternoon, everyone. My name is Aransa Sue Laskarine, and I am the Assistant University Director here at the Southeast Climate Adaptation Science Center. Thank you for joining us for a webinar series on the 4th National Climate Assessment, commonly referred to as the NCA4, where we're specifically exploring the Southeast chapter, and we are focusing on one key message per month, ending with the Tribes and Indigenous Peoples chapter in January of 2020. We wanted you all to hear directly from each of the key message lead authors with the opportunity to have a Q&A with them at the end of their presentation. Please keep in mind that we also want to make sure that the audience knows how to use all the components and data within each key message. So to that end, you may have seen a poll that we distributed here quickly, and okay, here we go. We're launching the poll. There's just 2 quick questions just to get a sense of what your affiliations are and how you might be already using or not using the National Climate Assessment. And we'll give everyone just a second to fill that out. And this poll will just help us figure out how best to continue disseminating the National Climate Assessment material. Okay, well, wonderful. Well, thank you very much for participating in that. We really appreciate. I'd like to introduce our speaker today, Paul Schramm. He is the Climate Science Team Lead for the Climate and Health Program at the Centers for Disease Control and Prevention, known as the CDC, out of Atlanta. Paul's work at the CDC focuses on the human health effects of climate change, including the impacts of heat waves, extreme weather events, and vector-borne disease. Paul coordinates the climate and health programs of the science activities and partnerships. But before we move to Paul, I'd like to give Dave Reed-Miller to allow you to, for him to have a few welcome remarks. Dave is now our acting director here for the Southeast Climate Adaptation Science Center, but importantly, Dave served as the director for the National Climate Assessment. And welcome, Dave.
Thanks, Aranza. Can everybody hear me okay?
We sure can. I can.
Great.
Okay.
So just to provide a bit of context here, the U.S. Global Change Research Program, or USGCRP, was established by an act of Congress in 1990. Among the mandates in that law was a requirement for a quadrennial assessment of how climate is changing and how those changes are impacting a variety of sectors across the country. Over time, stakeholder demand for and scientific advances have allowed an increased focus on more localized information. NCA4 emphasized regional information from its inception through extensive stakeholder engagement and a structural decision to make the regional chapters more detailed. I'm excited to see the Southeast chapter author team stand up this webinar series over the coming months to relay the climate-related risks folks are faced with throughout the region, and just as importantly, what some of the adaptation options are to address those risks. While few folks will actually read the entire 1,500+ page report from start to finish, you're welcome to do so, but you might not. It was really designed to be digested in parts, with stakeholders able to seek out information relevant to the decisions they need to make. The NCA represents the most comprehensive, authoritative source of climate information for the United States. But beyond the key messages, chapter content, and references, there are a few other unique components to the NCA that we hope support you all in your day-to-day work. I'll touch on just a couple of them here. For example, each key message is accompanied by a traceable account that gives the reader insight into how authors came to the conclusions they did, describing the evidence base and major uncertainties that can inform future research directions. Chapters are also interspersed with a number of case studies that illustrate how communities are grappling with some of the climate risks they face, providing an opportunity for both experiences and lessons learned to be transferred across the region. In addition, each figure has an eyeball icon associated with it on the NCA website, which I'll put in the chat window in a second here, that gives users access to detailed metadata for folks to recreate the figures and have faith in the findings. And some figures have a gear icon that directs the reader to the Climate Resilience Toolkit, which is a powerful resource with hundreds of case studies and a Climate Explorer tool that allows folks to explore dozens of climate parameters at the zip code level. So with that, I'd like to turn it over to Paul Schramm, who we're fortunate to hear from today. As Aranzazu mentioned, an author on the Southeast chapter and climate science team lead at the Centers for Disease Control and Prevention, where he'll talk about the chapter's findings as they relate to urban health risks.
All right, thank you for that introduction, Dave. And thank you again to North Carolina State University and the Southeast Climate Adaptation Science Center for hosting this webinar series. So what I'm going to be talking to you all about today is the first key message from the Southeast chapter of the 4th National Climate Assessment that was released last year. And that's focusing on urban infrastructure and health risks. Now, since I'm at the Centers for Disease Control, what I'll be focusing on mostly is the human health risks, with a direct focus on the cities across our region, and putting that into context of this first key message. One thing I will say before I start is that we definitely recognize that the impacts of climate change on rural areas across the Southeast are very important, and that will be covered in an upcoming webinar, and you can read more about that in other chapters of that assessment. But today's webinar will focus on urban risks. So here's what I'll be covering. First, just as a background, because I know we have a pretty mixed audience on this webinar, some basic information about climate change and how human health is affected by climate. Then I'll move into that key message, the urban infrastructure and health risks, specifically in our region, and touch on how growing urban areas across the Southeast are shifting vulnerability, the vulnerability in our coastal cities, and then focused on 3 specific impacts that can affect health: heat, vector-borne disease, and air quality. And then finally, just as a plug for CDC and some of the resources that we have, I'll describe some different things that we've produced, different data that's available to communities and organizations and people who are trying to adapt to these changes. This is a graphic that shows some of the potential impacts of climate change on human health. So it starts in the center with the various aspects of climate change and moves towards the outside in the various ways that health can be affected. And the point of this graphic is to show that the impacts of climate change on human health are very broad. You can see it ranges from heat-related illness to vector-borne disease, to mold after flooding, even malnutrition, pollen causing respiratory allergies. It's a really broad topic, and it involves collaboration across a number of sectors when we're trying to solve this problem. And this also isn't even complete. For example, you'll see wildfires isn't listed on here. It's hard to fit all of the potential human health effects of climate change on one slide. But again, this is just to kind of show that it is a very broad topic, and we're going to be facing a lot of these, and in some cases already are facing some of these outcomes here in the Southeast. So this is the 4th National Climate Assessment. Again, the Southeast chapter, if you haven't taken a look at it, there's the link. If you go to nca2018.globalchange.gov, you can see all of the regional and sectoral chapters. And there's a lot of good downloadable data, information, and other good resources within this Southeast chapter. And in the top right here, you can see what we mean when we say the Southeast. It's a pretty big region. And this is the chapter author team. So the National Climate Assessment had a huge number of authors. I don't know the exact number, but well over 100 different authors representing the federal government, state government, academics, businesses, nonprofit. So we had a pretty good representation of expertise on the chapter author team. I also wanted to acknowledge that there were a number of technical contributors as well as coordinators at the U.S. Global Change Research Program And there also was review from the National Academies of Sciences and also public input. So thank you if any of you gave public input to help improve this chapter. So moving into the first key message, I hate it when people read directly off of a slide, and this is a very wordy slide, but this is what we're focusing on in this webinar, and this is the exact approved wording for the first key message. So I'm going to go ahead and read it anyway, and then the following slides will kind of break down the individual components of this. So what was found in this National Climate Assessment is that many southeastern cities are particularly vulnerable to climate change compared to cities in other regions, with expected impacts to infrastructure and human health. The vibrancy and viability of these metropolitan areas, including the people and critical regional resources located in them, are increasingly at risk due to heat, flooding, and vector-borne disease brought about by a changing climate. Many of these urban areas are rapidly growing and offer opportunities to adopt effective adaptation efforts to prevent future negative impacts of climate change. So one thing I wanted to mention, this is just one key message from the 4th National Climate Assessment, which really is an update from the previous National Climate Assessment and gathering the newest science and looking at examples of new adaptation measures and interventions that have been put in place. So I do actually encourage you to go back and look at the 3rd National Climate Assessment, because there's a lot of good information that's not covered and not updated in this National Climate Assessment. So for this, because of the way that science has advanced, these are the specific topics that we chose to focus on. So again, I gave the website for the 4th National Climate Assessment, but I also encourage you to look back at previous National Climate Assessments as kind of a compendium of knowledge on the impacts of climate change in the Southeast. So let's start with urban areas. The Southeast has long been known as a rural area, a rural region, but our cities are growing really quickly. Here in the Centers of Disease Control is located in Atlanta, which is one of the really fast growing cities in our region. And in fact, many of the fastest growing urban areas in the country are here. So from 2016 data, 12 of the top 20 fastest growing metropolitan areas by percentage were in our region. So more than half of the fastest growing cities are here. And we're seeing an increasing trend towards a more urbanized and dense Southeast. Cities are growing, suburbs are growing, people are turning to urban areas, both moving within the region and moving from outside the region. So this creates some potential new climate vulnerabilities, and that's one of the reasons we chose a city focus for this key message, but it also creates opportunities. Cities have resources and they're able to adapt and put in place interventions to help protect the city and its people from the impacts of climate change. So that's one thing that I'll be focusing on as well. And you'll also see examples throughout the chapter of different adaptations that have already been put in place, for example, to protect from flooding or heat. So coastal cities is one area of specific vulnerability in our region. There are a lot of large and growing cities on the coast in the Southeast. This includes cities such as Miami, Tampa, Norfolk, Charleston, that are vulnerable to some things like hurricanes, coastal flooding, harmful algal blooms, saltwater intrusion. There's a lot of different climate-related vulnerabilities to these large and growing coastal cities. And here's one figure from the Southeast chapter that shows how warm waters contributed to the formation of Hurricane Irma. So I know there's ongoing similar research looking at how more recent hurricanes may have, that have impacted Florida and other areas across the Southeast may have been connected to changing climate. This is an example from Charleston of flooding that occurred. Extreme rainfall events like this are becoming more common across some parts of the country, which includes the Southeast. And what we're seeing is more of a drought and extreme rain cycle. So instead of just getting what used to be a normal amount of rain, we get this extreme flooding. And I'm sure many of you where you live across the region have seen an increase in some of these extreme flooding events. Heat is another big problem in cities. So of course, it's always been hot in the Southeast, but we're seeing an increase in heat waves. So the data shows that already the Southeast has experienced more summer heat waves and longer summer heat waves. Now the second bullet is a little bit confusing, so I'll explain it. There's a lot of different ways you can measure a heat wave. You know, it doesn't just have one definition. You can look at it by a number of different aspects. So one is timing. When is a heat wave occurring? You know, we might expect it in July or August, but we don't necessarily expect one in March or October. So timing is one way that we can measure heat waves. Frequency is another way. Are we having multiple heat waves per year? Intensity, which just gets down to how hot it is, sometimes how humid as well. And then also duration. Are we having longer or shorter heat waves? So these are 4 different ways to measure how bad a heat wave is. And nationally, a study found that there are only 5 large cities in the country where all of these are increasing. And it just so happens that 3 of those 5 cities are in the Southeast. Birmingham, New Orleans, and Raleigh are all seeing a higher frequency of stronger and longer heat waves that are occurring in new times of the year. So that's a pretty interesting finding from that study on how heat waves are changing in our region more so than other regions of the country. And then also looking at other cities across the Southeast, 61% of them are exhibiting some aspect of worsening heat waves. So for example, a city might just be having more frequent heat waves. And this again is a higher percentage than any other region of the country. And I know this is really relevant right now because this September has been pretty crazy in the Southeast. Here in Atlanta, I think our September is currently the second hottest September on record. We had just had our 4th high temperature day set. And so far for the year, 2019 is tied for the hottest year on record. It's tied with 2012. 3rd place is 2017. 4th place is 2016. So 4 of the hottest years that Atlanta has ever had are in the last decade. And we're seeing trends like this across different parts of the Southeast, especially in the last decade. And the climate models show that this is expected to continue. So I want to illustrate this with some graphics that are in the chapter on number of warm nights. So the reason why warm nights are important, particularly for human health, is that we need time to recover after a hot day. There's research that shows when we're exposed to high temperatures during the day, your body recovers during night. So we really need those cooler temperatures. And of course, it's also important for non-health things such as agriculture. Infrastructure is also impacted by diurnal heat cycles. But specifically for health, we really need those cooler temperatures. So this is the historic data. This is from 1976 through 2005, and it's showing the number of nights where it did not cool down lower than 75. So nights where you had a hot day, and then at night it was in the upper 70s, maybe the 80s. And that graph on the legend on the bottom that's showing the number of nights from that pale color, meaning there's 0, all the way up to 100, 150 in the darker red. So you can see there are some areas, for those of you that live in southern Louisiana or southeast Florida and some other coastal areas that have high humidity, you can see there are some areas of the Southeast that historically already have quite a few days where it does not cool down overnight. However, for much of the region, there's very few of these days. It just happens a few times throughout summer. So the next graph I'm going to show is how this is projected to change, and it uses this same color scheme. So you can see it's a pretty big difference. This is 4 different graphs under 2 different climate scenarios and 2 different time periods. So the top 2 charts are showing a higher scenario with more carbon dioxide released, and the lower scenario is the bottom 2. The two on the left are mid-century, so around 2050, and the two on the right are higher century, later in the 21st century. So worst case scenario is kind of the top right, best case scenario, the bottom left. But you can see a huge difference. I'll go back just briefly. This is the current number of really warm nights that we're having in our region. And this is the projected change. So you can see late century under a higher emission scenario, you have huge portions of the Southeast that have over 100 days per year where it will not fall below 75 degrees at night. So this has potential very large implications on human health and also on energy usage, higher amount of air conditioning being used at night, which can place stress on the energy grid and of course also has huge economic costs. So this is one of the areas that's of great concern across our region, especially for vulnerable populations and especially for urban populations where there may also be an urban heat island effect that's adding even higher to these temperatures. So vector-borne disease is another area I want to discuss and that is covered in this chapter. I'll start by saying vector-borne disease is very complicated. Here in the Southeast, we're mostly talking about mosquitoes. It's really difficult to model changes in the mosquito life cycle. And there's a lot of different factors, wind, precipitation, temperature, human factors that all influence both mosquito abundance, their breeding cycle, their activity, and also how people are exposed. So that's the caveat that it's difficult, but there have been a number of studies across the Southeast looking at this. And the overall findings on those studies is that climate change is likely to modify the seasonality, distribution, and prevalence of some vector-borne diseases in the Southeast. And with the urban focus of this key message, vector-borne disease does tend to pose a greater risk in the urban areas across the Southeast, largely because there's higher population density for these diseases to spread and other human factors. So for example, standing water sources in which mosquitoes can breed. So the projections and how this might change in the future is that summer increases in dengue are expected across every single state in this region, but winter temperatures will probably prevent permanent year-round establishment with the possible exception of South Florida. So there are projections that dengue will spread or is at least able to spread across the Southeast under a warmer climate. We're also the region with the greatest projected increase in potential cases of West Nile neuroinvasive disease. So this is one graphic from the chapter showing the potential of a certain species of disease-carrying mosquito. This was for the whole country where they looked at major cities across the country and looked at whether or not currently the conditions are good for these mosquitoes. And then from that, that's kind of a baseline where we can look forward and see how temperature and climate change might affect this. But you can see that the Southeast is clearly the region here with the greatest potential for this mosquito activities. So luckily there's a number of things we can do to prevent the spread of vector-borne diseases. For example, using insect repellent, wearing long sleeves. The CDC and others have a variety of different resources on how to prevent vector-borne diseases. And I think those adaptations are going to be particularly relevant in light of this data. Now I'm going to touch on air quality. Again, as with vector-borne disease, projecting future air quality is complicated. It's a very complex system, but there have been a lot of studies that have looked at it. And there's kind of mixed evidence for the Southeast and different parts of the Southeast. And I really encourage you to look at the chapter for more specific information and data on this. But what we're seeing is for ground level ozone, not to be confused with ozone higher up in the atmosphere. Ground level ozone is very bad for human health. Breathing it in damages the lungs and respiratory system. And we often have ozone at the ground level produced in cities on very hot and sunny days. And largely that's being created from vehicles, and then the ozone is created once it interacts with sunlight, and temperature. So we don't want ground level ozone. And what we're seeing is it's a chance that in the summer, because of changes in wind shifts and precipitation, we may have some areas of the Southeast where ground level ozone is lowered, which is great. But what studies have also shown is that warmer and drier autumns may result in a lengthening of the period of ozone exposure. So right now in the summer, you might see air quality action alert days where they recommend, for example, that you might not want to exercise outside, or if you have asthma, you may want to take precautions. It's expected that that might get better in the summer, but it actually might get worse and be extended out into the fall, where we're seeing more of these high air pollution days in the fall. We also know that continuing rising temperatures and also just the carbon dioxide in the atmosphere are affecting plant growth, and especially aeroallergens such as pollen. So there's a number of studies that have looked at pollen monitors across the Southeast and have found that already we're having a shift into longer pollen seasons and more pollen being created. And this is a trend that's expected to continue. So that definitely has a potential impact on human health, especially people with existing respiratory health conditions. And it also is potential for higher economic costs for people who need to be taking allergy medications. And then also drought conditions may impact wildfire smoke. So we do have wildfires as well as peat bog fires across many areas of the Southeast that can impact a variety of things, including respiratory health. But luckily there are some potential adaptations for that. And I'll show a graphic of one of those, which is prescribed fire. So this is something that's been done by the Forest Service and other partners across our region for a few decades. And it's an effective adaptation that not only has helped to improve ecosystems, but also can help cut down on the number of wildfires. So this is an example of a potentially successful adaptation that's already being used. If we're worried about climate change causing drought, which in turn could cause more wildfires, these prescribed fires are a good way to potentially prevent that. So that's a summary of the high-level points of the key message number 1 in the Southeast chapter of the National Climate Assessment. And what I want to shift into briefly is what Centers for Disease Control is doing and some different resources we have if you or your organization are trying to work on this problem and implement adaptations. So I'll start by saying first, these are just the CDC resources. Please do go to the U.S. Global Change Research Program and the National Climate Assessment for additional resources. There's data on there, there's downloadable graphics, there's downloadable presentations, there's a lot of great things that are really useful on there. But as far as CDC, one of the main things that we do is fund jurisdictions work on this, specifically the health impacts of climate change. So we directly fund 16 states and 2 cities, but there are a number of mini grantees and tribes that we work with partners to fund, and we provide technical assistance to them. So in the Southeast, we fund the health department in North Carolina, and we also fund Florida State University as a bona fide agent of the health department in Florida. So they're actively doing climate and health adaptation work to help protect their communities across their state. They do this through the BRACE framework. So this is another thing that's targeted at health departments, but certainly anyone or any organization could use if they're interested in adapting to climate change. So this BRACE framework has 5 steps, and it starts with anticipating climate impacts and assessing vulnerabilities. So for example, in your jurisdiction, you might look at what the past climate has been like and what future climate might be, and if there are particular areas or people or communities that will be more affected by those changes. The second step is then to look at projecting the disease burden. So that can be complicated. It can be a complex research project that's showing potential number of asthma cases in 2040, or it can be much more general. It can be, hey, we think based on the climate data and based on our health data that we're going to have more deaths from heat waves, and we should begin preparing for that. The third step is then to assess interventions. What do we do about it? So in my example for wildfires, doing a prescribed burn is a potential intervention. And then finally, moving on to actually developing and implementing an adaptation plan. And then the fifth step really is an overarching step, as this is an iterative process, but evaluation is important to make sure what you're doing is actually working. So we have a lot of different tools and resources available on our website for people who are interested in implementing BRACE or doing any other type of climate and health adaptation work. So our website's cdc.gov/climate and health, and you can see some of the different categories we have here, ranging from archived webinars to different videos, data, tools, guidance, training documents, etc. You can find those all on our website. We do have a lot of technical guidance documents for health departments. So these are more for people at a professional level who are actually implementing this work. In some cases, they're very specific down to computer code that's needed to assess something or information on mapping. And I will show an example of that that's relevant to our region. We have this Assessing Health Vulnerability to Climate Change document. And it goes through all the different steps that are needed in order to do a vulnerability assessment. And one of the specific examples that is used throughout the document is the state of Georgia. And this document shows how you can overlay different data sets, how you can map that, and how you can come up with a composite vulnerability index. So I do recommend you take a look at this one if you're at all interested in being able to map and assess vulnerability to climate change. We also have tools that are aimed directly at the community, a number of PDFs, fact sheets, guidance documents, videos, etc., as well as a whole set of modular slides. So that is available for the National Climate Assessment as well. There are slides you can download if you want to be able to present about this material. So that's on the US Global Change Research website. But for CDC, we have a modular slide deck with a variety of climate health slides that you download, you can shift around, you can put your logo on it. They're completely modifiable and useful for if you're reaching out to stakeholders or doing a community meeting or something like that. We also have a lot of data. So I think this is really broadly applicable. We work with National Environmental Public Health Tracking Network, which is a sister branch of ours here at CDC. And we've worked with them to put a climate module on their data portal. So this is online, it's publicly accessible. You can see the webpage link there. And they have a ton of environmental health and environmental data sets on here. But specifically for climate, there's a lot of different data on temperature, on precipitation, drought, climate vulnerability, etc. So this online platform allows you to map that data. It allows you to compare. You can create an animation that shows how the data is changing over years. You can download the data. You can put it in chart form. So it's a really useful platform. And it's great if what you're trying to do is have health data and climate data all in one place and you want to pair it together. So there's a lot of different measures on there. Just for example, there's 12 different vulnerability measures that relate to sensitivity to extreme heat. So you could pull that up for your county. Most of that data is on the county level. Some of it's also available at the census tract level. And for much of that data is available for most of the country. So if you haven't heard of this before, I do urge you to look at their webpage and consider this as a data source. We also have a guide on climate change, health, and equity. And I think equity is something that's really been a focus because climate change does disproportionately impact certain populations and regions. So we worked with the American Public Health Institute, American Public Health Association, the Public Health Institute, and the Center for Climate Change and Health to put together a whole guide on climate, health, and equity. Again, this is linked from our website. And then finally, and I think particularly relevant to the mixed audience on this call, we recently released a guide for cross-sector collaboration on climate and health, and that covers 10 different sectors and gives a lot of guidance on how these different sectors can collaborate to help protect health from a changing climate. So these are the different sectors that are included. So if you happen to be in one of these, so for example, if you're in transportation or energy or urban planning or water management, This is a way for you to really get involved in human health and to start to address that first key message in the National Climate Assessment. It includes information on how you might reach out to a local or state level health agency to move this work forward. So that's all I wanted to cover. I really do hope that you'll check out the National Climate Assessment website. It's really snazzy, has a lot of content that's downloadable, and also CDC's website for some of the resources we have. And with that, I think we'll open it up for questions.
Thank you so much, Paul. That was a wonderful presentation. We really appreciate it. And I think because we have a manageable crowd, we can unmute folks and just let folks ask you questions directly and, you know, and engage in a conversation. I did just want to say real quick that we will be posting these presentations. We're recording the presentations and we'll be posting them to our website, which is ccask.ncsu.edu. And then we'll also be promoting the next set of webinars in our newsletter and website as well. So to that end, we will open it up.
We'll allow people to unmute themselves.
Okay, so I've been instructed to, everybody can unmute themselves. So you can unmute yourself should you want to ask a question to Paul. And if you don't want to, you can also put a question in the chat box, and that's perfectly fine too.
Yeah, and I'd also be interested if no one has a question immediately, if anyone who does not work in public health or does not have a focus on urban areas, if you have any examples of how you've been collaborating across sectors, because I think that's something that we at CDC and also the U.S. Global Change Research Program really have been promoting. And those are, if there are successful things that come out of those collaborations, it's things that could potentially be included in the next National Climate Assessment to highlight the work that's being done across our region.
Mm-hmm. Good point. Yeah, great point, Paul. Okay, we've got a question here coming up.
Okay, so I'll come there. So I have a question about this race program, Paul. How
Yes.
and you showed the states that were involved in that. How is it possible to include more states in that funding effort to sort of push along this effort to do climate, climate and health, climate effects on health sort of adaptation?
Yeah, and that's our goal. So I'll first, one thing I will say is that you don't necessarily need funding from us to implement BRACE. So of course funding helps, being able to have staff helps, but all of our BRACE materials are publicly available. Our guidance and description of BRACE, a video about BRACE are all on our website. So there are actually a number of health departments and other universities, et cetera, across the country that are, and tribes as well, that are in some way implementing aspects of BRACE, or in some cases just kind of using it as a guiding framework for their existing work. So that's one answer. The other answer is yes, I would love to expand this map. We do have funding opportunities on a 5-year cycle, with the next one coming up in 2021. So we're hoping to be able to add jurisdictions at that time. Another thing that we've done is to partner with nonprofits to be able to get some funding to regions and jurisdictions that need funding on climate and health. So as I mentioned, we only directly fund 16 states and 2 cities, but you can see some counties, some additional cities, and there's more than 16 states outlined here in green. And that's because of our partnerships with organizations such as the Council for State and Territorial Epidemiologists, or the National Environmental Health Association, and the National Indian Health Board. So we get some funding through proposals that are submitted to those nonprofits. And in that way, we're able to do kind of mini grant projects across the country. One thing I'll also say is that once we do fund a jurisdiction, we really like to keep funding them in order to maintain capacity. We don't want a program that, you know, fires up and is doing good work, and then the funding gets cut and they have to, you know, they lose the staff and climate and health work just stops. So we do try to continue to fund the ones that we're already funding, but we always are looking to expand that. And of course, that's budget dependent.
Mm-hmm. Thanks.
Paul, you have North Carolina highlighted in green. What?
Yes.
Yeah.
So we directly fund the Health Department of North Carolina, Department of Health and Human Services in that state. So they are working on a number of different climate health projects throughout the state. That includes, for example, looking at some impacts of heat on agricultural workers and other outdoor workers in rural areas of the state. And they've worked at looking at heat alerts and various other resources that are available for rural agricultural workers, specifically on heat. I know they've also worked on coastal flooding, as well as peat bog fires. So there's a lot of work on various climate health topics throughout the state.
Mm-hmm.
And similarly for Florida, since we're focusing on the Southeast, Florida, they have some mini grants out to counties. I think Volusia County is funded off the top of my head to actually evaluate some climate and health adaptation activities and to see, do those work? Are they actually protecting people? And then Florida has done past work on health impacts of hurricane and vector-borne disease.
Mm-hmm. Great. Any other questions?
And I'll go back to the link to the chapter just so everyone has it.
Yeah, that's a great idea.
And if anyone's having trouble unmuting, you can raise your hand and we can unmute you. That's helpful.
Yeah.
I have another question, but I don't want to donate.
we have here lots of questions for you, Paul, so we'll keep a couple coming. One is, can you talk a little bit about the urban heat island effect of cities? And, you know, does the data that you show about future, well, I was just thinking, you know, does the data reflect sort of the increased heat that already exists in urban areas? Can you speak to that a little bit?
Right. Yeah, so there's a couple ways to look on that. First, if anyone's looking just for background on the urban heat island, EPA actually has a lot of great resources that just explain what it is and how it works. But essentially, because cities have landscapes that absorb and retain heat, so that could be roads, buildings, etc., they're often much warmer than the surrounding area. So that a downtown area of a city can be 8 to 10 degrees warmer than a forested or rural area just a dozen miles away. So that, of course, causes problems on extremely hot days, and it also helps to increase nighttime temperatures. So if you're just looking at, say, impacts on health, you want to know what people are actually experiencing. So you'll just go by the temperature that is measured that includes that urban heat island effect. But if you're trying to look at trends over time, you can remove that urban heat island effect and use a variety, you know, there's temperature sensors all around the country. So when they're looking at how temperature has been changing across our region, that urban heat island effect is actually scrubbed out because you don't want a false signal that's, you know, some areas warming from climate when really why it's warming is urbanization. So there's a variety of methods to scrub that out and to compare it to areas where you know, a more rural or forested area where nothing has changed to make sure that we're looking just at what the trends are for climate change. So when I talk about those warmer nights in the past, yes, that's actual temperature data, but the projections are talking about, you know, independent of things that might be happening from other non-climate factors. So that would just be the climate signal.
Mm-hmm. Great, thanks, Paul.
So I'll jump in with another, if that's all right. This is Carrie Furness. So you, this issue of vector-borne disease that you mentioned, do you have a sense of what research might be sort of most helpful in order to gain a better understanding of how to predict or, you know, more fully project some of this abundance of some, especially mosquitoes and in the Southeast and other sort of vectors, I guess.
Right. Yeah, and as I mentioned, that's a really good question because it's such a complicated issue. A lot of the recent research that has been most useful is looking backwards and looking at where there were vector-borne diseases, cases of them, you know, where people reported to a doctor or hospital for these vector-borne diseases, or where the health department or CDC confirmed, say, an outbreak or even just a few locally acquired cases. So what's been useful is taking that information and pairing it with the weather information at the time. And with that, we can build that connection. And that's been done in a lot of areas where we can see, okay, yes, temperature has an influence, or okay, yes, wind or precipitation has an influence. But we need that baseline connection between health and weather in order to be able to tie it into future climate. You know, how much, if there's a couple degrees of warming, what does that actually mean? And I think another part where there's an opportunity for a lot of research is on the specific life cycle impacts on a mosquito. So for example, if we're talking about the larval stage, how does extreme rainfall affect that? Or if we're talking about the adult stage, does temperature change the number of hours of day where they're biting? So there's a lot of research already done on that, but I think there's still a lot of questions out there, and then being able to tie that to future climate projections.
Paul, that's super helpful, especially to us here at the Southeast Climate Adaptation Science Center, where we do fund some of this type of research. So thank you for giving us an idea of what those needs are.
Yeah, and CDC has a center that focuses on vector-borne and zoonotic disease. So if anyone on the call is particularly interested in impacts on vector-borne disease, I'd also be happy to connect you to the experts there. And then also within the water branch in our part of CDC, there are a few subject matter experts on vector-borne disease who largely work on prevention. So for example, when spraying has to be done, they have information on that and the environmental health and human health impacts of that spraying.
Great. Just waiting to see if anyone has any more questions. So Paul, you mentioned the, or maybe it was Dave actually, the Climate Resilience Toolkit, and I'm wondering if there's some specific studies. I haven't taken a look at our poll to see how many people from local government or the community, but I wondered, especially planners that might be on the call, city planners, that are interested to get some case studies or best practices that could help with, in particular, heat issues, urban heat islands. So I wonder if there's some specific case studies in the toolkit that people can refer to.
Yeah, so I'm not sure if Dave is still on, but I know there are a lot of different case studies on that toolkit that can be, there's a climate explorer, there's a number of things separated by impact like flooding. So I think the best way it would really be for people to just go on it. It's toolkit.climate.gov and just kind of use the search feature to try to find things that might be relevant for you. So there are case studies on there, there's tools, there's different topic areas, and then also you can separate it by region. So it is already, you can restrict it to the Southeast region if you're just looking for things where you are.
Super, super, Paul. Yeah, and if you, and folks on the line, if you hit the chat link at the bottom, you can see some of these URLs that Dave has been posting there to help you reach those locations easily. Okay, well, I just wanted to give a couple reminders to folks before we close for today. Again, Paul, thank you so much for a wonderful presentation, and your delivery was excellent, and your resources and examples. I did want to mention that our next webinar will be October 23rd, and then for November, it's November 20th. You can find out more information at our website at secasc.ncsu.edu. And should you want more information about the CCASC, you can sign up for our newsletter, which is on our website at the very bottom. You can sign up for newsletter, which we do monthly, and that provides lots of good resources, news, events, conferences, opportunities that might be helpful to you. And so we look forward to the next webinar next month. We hope you'll join us. We hope you'll spread the word and invite more colleagues to join. And to that event, thank you so much, Paul. I just also wanted to say, if people want to connect back with Paul, we have I believe his title back at the website. And I'm sure they could probably Google you at CDC. Is that correct, Paul?
Yeah, and it's if you want to contact me directly, it's just pschramm@cdc.gov. So pschramm@cdc.gov.
Wonderful. Well, thank you everyone for joining us this afternoon. We really appreciate it. And we look forward to next month. Thank you so much.
Thank you.